Welcome to Medical Confessions.
Your remedy for serious medicine. I'm Jen.
I'm April.
And I'm Scott. Today we're going to be talking about if your hand and feet size equals penis size. We'll also be talking about how erections work.
Good times. Good times all around. I was just last night wondering how all those things correlated. Like, that was just something that
I don't know if it's true or not, but I like to imagine, and I always look at people's hands and feet and try to guess. Oh,
Guess
yeah,
how big
he
they're-
must.
Is that where you are, like, all the time when you're, like, out in the middle of nowhere?
Shopping or, like, bored.
April.
So men look at the chest and women are looking at the hands.
That's not true. I don't think I've ever looked at a guy's hands and been like,
I just
oh,
saw you
yeah.
sneak a look at my hand.
Like, never, like, maybe as a joke I've done it, but I've never, like, sized a guy's quality up by, like, all right.
I try and guess all the time.
Look at those size 14s.
And especially if I know the size.
Yeah, that's funny. Okay, I take that
So, hold
back.
on,
Sometimes I have seen guys with small hands and I've been like, oh, ouch.
Ooh, yeah. What is it? Donald Trump has tiny hands? Is that?
Yeah, I've seen
tiny
like,
little
the
hands.
memes. So,
But he has big feet. Right?
Does he? I don't know.
I don't know.
I know he's got tiny hands.
No, I think he wears size 12-foot shoe.
Yeah.
Good for him. Good
So
for him.
what's the real, like, so does feet and hand size indicate, I mean, it makes sense, right? So if you think about a person's, like, wingspan being typically the total height of the person, so it makes sense that your body would
You
coordinate.
gotta imagine their size, proportionally speaking, they've got to be bigger. But,
Right.
no, that's not the case. So when you're first conceived, everybody's pretty much the same. We all have a group of tissues called gonads, somewhere between.
That makes me laugh.
The term gonads makes you laugh.
Well, because, like, it's used in slang, so sorry.
Well, I
go
just
ahead.
remember in, like, sex ed, they talked about gonads, and then that was the go-to term, in 6th grade. Oh, look at the gonads. But anyways, but no, so somewhere around 6 to 9 weeks, your gonads will then differentiate and start releasing different hormones. If you're a man, it releases 2 different types of hormones. One is called anti-Mullerian hormone, and that one is basically a hormone that reduces or prevents the ducts that later turn into your fallopian tubes and your uterus and your upper vagina. That will prevent those from forming. I said upper vagina.
You said
really
vagina.
Bunch of kids.
Should I say like bajayjay? You ever see that?
Oh, no,
Bajingo.
Bajingo? Scrubs. Love
Yes,
that
that's
show.
Scrubs. That's a Scrubs reference.
But it'll also start releasing testosterone. Testosterone, when it does, about 5 to 10% of it turns into dihydrotestosterone. And what that does, well, I'll just call it DHT, so I don't have to keep saying that word. But what that does is it mediates some genes that will basically form the penis and the scrotum. So the greater the amount of dihydrotestosterone you have in you, the bigger your penis and scrotum will tend to be. It's not like a for sure, but it is just a what do you call it? A chance that they've got a greater chance it'll be bigger. What's happening about the same time is there are other genes that promote bone growth. So the bone growth in your hands is endochondral ossification, and the genes responsible for that also are mediated by androgen receptors. Dihydrotestosterone will stick to androgen receptors. So the more circulating DHT you have, the more, or obviously the bigger your penis and scrotum will be, and also the bones in your hands will then tend to grow better. And that I said horribly.
I don't think so.
Oh.
I mean, that makes sense. That explains it.
So when it comes to the ratio between the two, the genes responsible for that growth in your hands, in your ring finger, they are stimulated more than your pointer finger. So the more DHT you have circulating around, the larger your ring finger will be compared to your pointer finger.
And so that's from birth on?
So that most of it is prenatal during gestation. There is some increase you can get during puberty, but that's not really as much of a factor as the prenatal stuff.
So even a young child, you can look at the ratio, I'm guessing
Yeah.
is what it is, between
Yeah.
the two. And so you can even,
Guess if they're going to be,
that's kind of sad.
a Dirk Diggler of the world.
Well, what about, so then, because Jen and I have our ring fingers that are
Mhm.
longer,
Right. Significantly. Like on mine, it's
would
almost
that
like
correlate
a
to
fingernail
clit size?
Wow.
Oh, wow, you just busted out of that, huh?
I knew.
Well, no, actually, I've never read a study that says that, but I mean,
I'm curious now.
I'm uncomfortable.
at what point does it change from a really large clit to a small penis?
Exactly.
Is the real question.
I've always wondered.
Yeah.
All right, we're digressing, and I don't know if this is not that type of show.
Okay.
But so really, all you're doing is by looking at your finger ratio is determining prenatal exposure to hormones. So if you have a longer ring finger compared to your pointer finger, you had more DHT circulating around somewhere around 13 weeks of gestation. That's usually when your finger length is pretty much set.
So we
at
were
that
almost
point.
boys.
You were super close.
And nobody would argue with that with me. They'd be like, nope, makes sense,
Yep.
right?
As long as it's not like a episode of The Crying Game.
Right,
you know,
no,
where-
but
Um,
April and I walk that line.
So yeah, that's interesting you say that because most women tend to have their ring fingers shorter than their pointer fingers.
So
and
now
most
I'm
men-
like interested. I'm now going to like scope
Research
out
it,
my girlfriends, and like check, be like, darn.
Yeah.
Oh, yeah.
Well-
I made Jess show me his fingers last night.
Oh, measuring them.
Yeah.
Ratio.
Well, no, I didn't measure. I didn't go through the whole ratio thing, but I did look at his fingers, and then I
Eyeball it.
also asked him if he had ever measured.
Well, do we want to measure
he
and see
measured?
what your?
Yeah, he had. He said in high school he tried one. He measured once.
And is this specific to, well, this will lead way into our next topic, but so non-erect? That's a whole
So-
nother.
Well, so funny story. Flaccid penis length is actually not a good determination of actual erect penis length. It varies way too much. The term "I'm a grower, not a shower" kind of comes into
I've
my
never
head.
heard that before.
You've never
heard
heard
that before.
No way.
I've never heard that before.
I guess-
I'm a good kid.
You're not.
I guess for us guys who had PE class and you're swimming in the pool, you come out and guys are looking and you're like, dude, I'm a grower, not a shower. What do you?
Oh my gosh. That's awesome.
Anyway, yeah, no. So, but interestingly enough, so when they do the studies, they look at two things. They look at fully erect penis length and they look at stretched penis length. And stretch means you are taking that flaccid guy and stretching it like a rubber band.
Oh, so somebody else is doing this for the subjects.
I would hope that the person was doing it because I really don't want
Yeah.
somebody with a ruler and just, rubber
But I
banding
think
the
there
crap
could
out of
have
myself.
another
inch.
consistency, though. Like a good study, like another person would have to be there. Like, how do you?
Yeah.
Could you imagine, like, the guy getting that measure? Like, come on, I can a little more. Just pull it a little more.
I can take it.
I need to warm up before we start. So,
But so they do measure both the stretched penis length and the erect length, and they're actually pretty close. But do you guys want to see your ratio? We can do it. Why we never actually explained how to do that yet.
sure.
Yeah.
Sure.
So you take.
Do we need a ruler?
So we do need a ruler. It
Okay,
looks
I
like
think we
our
can
handy
borrow one here.
guy has one there.
He's keeping it in check here.
So how you do is that you measure from the crease of your hand
Okay.
to the tip of your finger.
When centimeters, is that best?
Inches, centimeters,
Inches,
doesn't matter.
Okay, I'll go inches
As
here.
long as it's uniform.
Okay.
And then measure the other one and divide your pointer finger by your ring finger.
Okay, that's going to be a little bit of work, so I'm going to give you numbers. Somebody have a calculator?
No.
So I got 3 1/4, almost exactly. And this is 2 3/4.
2 and 3. So yeah, that's a pretty high ratio actually.
Oh, yikes!
Great.
And are both of our hands the same, or is my left hand going to be different than my
well,
right?
let's find it. It should be uniform,
just
but
the
everybody's
crease,
a little bit
Right at
different.
the crease. But you can see it's like a full fingernail
Yeah.
difference on there. almost.
You are a man.
We need to not share that with you.
Yeah, 2 3/4.
So when your kids tell your husband that you wear the pants in the family, you can say, well, according to
Check
my
out
finger
the ratio.
ratio.
Check out the ratio.
Mm.
Are you the same?
Not. I'm just in between the 3/4 and what would you call that, Scott? On this one.
Oh, yeah, you're 2 1/4, so basically.
So you're
no,
all
that
close.
would be a quarter. That's half. Right?
Oh, I see. That's the 3. Yeah,
Yeah.
2 1/2. And then what's your other one?
2 3/4.
2 3/4.
Wow, both of you.
Yeah. You're a lucky
I'm
man.
jealous. Yeah.
You're a lucky man, Scott. Oh.
So yeah, there you go. You guys had exposure to more DHT. Or
Put that
estrogen
in.
receptor A actually is another hormone that affects that. And that'll actually decrease the growth of your ring finger. So
Sorry, what?
She did her April thing.
Yeah,
She's
she did.
checking out your...
You were checking out my hands, weren't you?
She's looking at your
Sorry.
ratio.
I have an agreeable ratio, April. Let's just leave it at that.
No, really. I mean, have you ever measured? I don't want to know the size. Have you?
But she
at some
does.
point?
There is no respectable teenage boy that did not pull out a tape measure
That's
at
what I
some
think.
point.
Yeah, I mean, I'm sure they do. It's just
Oh, yeah.
something I've never thought to ask or,
Well, and
I-
the big one, like,
despite my ratio, I wasn't a teenage boy. So
well, and I remember thinking measure because, you don't really know how you're supposed to measure it, scientifically, so you're just, whatever's going to give
Just
you the
going for
longest
it.
length, so I remember thinking, well, I'll just measure from the back instead of the front because that gives me a whole extra inch, that's all,
So I'm wondering, though, did you take the family ruler and put it back in the junk drawer when you were done?
It was actually my dad's tape measure.
Oh, jeez.
You didn't hear that, Dad.
Sorry, Dad.
Didn't happen. And of course I cleaned it appropriately afterwards.
Oh my gosh, that's horrible. Oh. very good.
Anyways, yeah, so when they do the studies, they actually measure from, if you want to know your length, you're supposed to measure from the front, from where, the base of your stomach or pelvis at that point, and then to the tip. Average size being 5.17 inches, in case you were curious.
So what's the ratio then from non-erect to erect? Like, what's the standard, or is there a standard?
Well, actually, the 2 or 3 studies I've read, that it varies a little bit, but about 3-fold increase. But again, the flaccid length isn't really a good indicator because it really, when it comes to erect length, is what you want because that really is the maximum amount that thing's going to get.
Right.
But the flaccid length can be determined by things like temperature, blood flow. There's so many things that can change your flaccid length. You can't really say
Right.
that's
Definitively.
different, yeah.
Gotcha.
So you do need to have a fully erect member.
Yeah. So let's just use April's example. A guy that walks in with a size 14 shoe is not necessarily more well endowed than a guy with a size 8 shoe.
So let's just talk about what causes a erection if you get aroused. Whether you're just thinking about something that's getting you aroused, or you're lucky enough to have somebody play with you and get aroused. What first happens is your brain releases nitrous oxide, or nitric oxide, and then in this particular case, that acts as a neurotransmitter. What nitric oxide does is it signals another molecule called guanylate cyclase, and that guanylate cyclase will then turn into cyclic guanine monophosphate, and we'll just call it CGMP for short because that's easier.
I don't even. You could have made up anything, and I would believe it. So.
Just string a bunch of 5-syllable words together. No, but it is called cyclic guanine monophosphate, and that GMP is a smooth muscle relaxant, and so inside your penis, what you have is you've got 3 kind of sort of hollow caverns. If you ever seen the packing peanuts, or not packing peanuts, what are the popper things
Yeah,
called?
I know what you're talking about.
It's kind of like that. There's little things called sinusoids inside these little pockets. Corpora cavernosa is the name of these, for lack of a better term, shafts. And then inside those are these sinusoids, and there's blood inside of there. And when you have a smooth muscle relaxant, more blood is allowed to flow into the penis. That will then start the process of your penis becoming larger. Once that happens, it pushes on the tissue that surrounds the penis, called your tunica albugini, if I'm pronouncing that right. Those on YouTube, don't make fun of me for pronouncing that one. I think it's French. Anyways, when that excess blood then pushes on the tissue, your veins reside on the outside of that tissue, and then so that excess pressure will push on your veins. The arteries then are supplying more blood to the penis. The veins that carry the blood away are now getting compressed. And so now it's like a garden hose effect, and you get more pressure in your penis, and now you get in a large erect penis. And as long as that CGMP is working, your penis stays erect.
And so if people that have problems maintaining an erection,
so erectile dysfunction.
Yes.
So those meds actually, they use a different molecule called phosphodiesterase number 5. We'll just call it, PDE5 for short. But PDE5 will actually break down that CMP. So if you inhibit that, then you get more CMP, which causes more smooth muscle relaxing. So at the end of the day, ED drugs just allow the muscles in your penis to stay relaxed and more blood flow to come in.
And that's great. I'm actually...
That's great, I don't care.
Well, no,
I just
like
want
I'm
the penis to
actually...
be hard.
No, that's not even... I'm not April. That's not even... My mind was going somewhere else because that was not part of our homework. Like, I came up with that just, like, on the fly just now, like the ED part.
Mm-hmm.
And I'm wondering how you know how well the ED drugs work and how you were able just to pull that out with no... like no homework, no.
Well,
I'm
funny
embarrassed
story.
for you right now. Like you were like on it.
Every dude wants to try the little blue pill.
But not every dude studies on how it works and memorizes the 5-syllable molecules that allow him to explain it very easily.
Well, if you're going to talk a prospective mate into letting you do it, you got to have some knowledge behind you. Otherwise, what are they doing? Feed me crack? I don't know.
I'm just I did not expect that thorough of an answer. I just thought you would be like, yeah,
They work.
it works.
And it does work. It's awesome.
Yeah.
If it works for longer than 4 hours, it's a bad thing, apparently.
Right.
Which
So-
actually is, because blood flow will get trapped in your penis for too long, and you can actually then...
Well, and that can be done manually. Like I've had a
True.
patient that decided to use a wedding ring as input. Yeah, we had to remove the wedding ring. It was very interesting.
That's
Were you able
sad
to
for
get the
him.
ring cutter around there? 'Cause
We did.
It seems like
We
that
actually
thing's pretty
went through
engorged.
a couple of ring cutters. It was
Oh.
very... I actually let our male coworker do the honors. I assisted
one's
from
all you.
afar. Yes, because usually I'm the one that gets stuck with the bad tasks, and so I kind of allowed him to take the...
Oh my god.
Yeah, we actually went through two ring cutters. There was some anatomy that jammed things up, and the unfortunate part is that we were not nowadays. They're not like most people's rings are not just gold, you know, and so the ring cutters. So he actually had to be transported, and they had to surgically remove the ring. And the docs explained that it was probably going to be some long-term damage to him.
Well, yeah, they call it compartment syndrome, but if blood stays in any
And
compartment...
depending on his ratio, the
Yeah.
compartment syndrome could be
That's a whole lot of blood, you know?
or not.
Yeah.
You're
How did
going
he
to be
get
fine.
his-
Don't worry.
Rings are pretty small. How the hell?
I know it
Well,
gave some great
He didn't have
conversation.
agreeable finger ratios, the problem.
Clearly, yeah.
But that's the purpose behind, you've seen, for lack of a better term, cock rings, and that's the purpose behind them. They're cutting off the blood flow going out so that
And is there
the
like
blood
an
stays
escape
in.
hatch? I mean, is there like because
They're usually pretty flexible.
I feel like the ones you get from,
They
like...
good to know. I have never
So
seen
don't
one.
use a hard ring is what you're telling, what we've learned here today.
All right. Anyways, back on topic.
Well, yeah, so if your blood gets trapped for too long, that blood will slowly get more acidic, and once the acid level gets too high, the cells will die, and
Right.
then if you get dead tissue in there and then you reintroduce that back into your body. That's actually a bad thing. You can cause some cardiac dysrhythmias with that. But yeah, the localized damage, I mean, it's like frostbite, right?
Right.
I mean, at some point, it's going to die, and you're going to have to whack that thing off.
Ooh.
Bobbit style.
Yeah. Yeah, that's not good.
Who was that guy? Bobbit? Lorena
Yeah.
Bobbit?
Yeah.
That was her name.
Didn't he go on to,
I don't know what.
a
Did he do
career
some
in... Yeah,
porn?
he did.
What?
I believe he did. Another thing to Google. We need to make a list. But yeah, I believe he went on to have a quasi-successful film career.
Good for him.
Yeah, I mean, what else do you do at the point? The world knows your biz.
Literally.
Cash in on it. And I think that, yeah. So my question now is then, why is it that, part of my reading led me to believe that more frequent erections allow a male to be longer?
Well, so there is a study out there that says that the more frequent erections you get long term will allow, when you are erect, for your erect penis to be longer.
So isn't that like a win-win for everybody? Like the guy can be like, we regular, and the girl should be like, okay,
This is
regular.
the excuse that I tell her all the time. It needs to happen. Otherwise, honey, it's not going to be as good for you.
Yes, it's about you at this point. So there is validity to that. Then.
There is, and it's not, I don't think it's that drastic of a difference, but it is enough that it is measurable in the study, and I don't remember exactly which study it was I read, but they did say there was a statistically
Notable.
significant difference. So those poor gentlemen that maybe don't get it all the time, it sucks for them.
Yeah, it's like taking a step backwards then.
But you can,
Manually.
self-stimulation will do the same thing. It's just not as awesome. A
Right.
2-player tennis game is much better than a singles match,
So
Anyways.
then, how does that work then with age and men's abilities to produce an erection? Then why is it that with age, at times it's more difficult or?
Well, there's so many things that can cause erectile dysfunction: diabetes, coronary artery disease, trauma. A whole host of things can cause that. What the studies say is the older you get, the more prone you are to ED. But it's not until like your 70s that it's actually that great of a percent. And I think in your 70s, it's like 40% or in the 40% range of people have ED. So it's pretty late in life because even your 50s and 60s, it's a low percentage and it's below 20%. I don't know the exact number, but it's pretty low.
Well, and I guess it would make sense too then that ED is not necessarily correlated to decreased appetite, we'll call it, or desire. So
No.
and that could be a whole different topic, I suppose. So
I don't desire you, so.
well, I just mean like, as you age, you always hear older couples and it not being as important or, whatever. So maybe it's not necessarily a physical dysfunction. Maybe it's just
Well, I don't know.
I'm old, my body hurts and I'm tired. I don't know.
My hip's sore. I don't know. They do say that the fastest growing population for STDs is nursing home patients.
Oh dear.
And it makes sense. I mean, if at that age, does it really matter? I mean, just do what you're going to do. If you want to be a heroin addict at that age, just don't drive.
Is it is it herpes that causes, isn't there some brain issues? Like if you have herpes long term, isn't there some, or which STD can cause
Syphilis.
Is it syphilis? Maybe that's what I'm thinking of.
I don't know much about syphilis. I know herpes. There's so many. Everybody's got herpes at this point. I mean,
I love talking to
I
you,
think-
Scott.
Yeah.
It's real good for the soul.
well, it is. Well, I mean, chicken pox is herpes.
Yeah,
Zoster's is
right.
herpes. I mean, there's like 8 types of herpes viruses, and if you haven't had one by now, I mean, if you got the chicken pox vaccine, they gave you a vaccine for
Right,
herpes.
you've had herpes. Well,
Oh.
where I was going with that is maybe we don't have this national crisis of dementia and Alzheimer's. Maybe all of our elderly just have syphilis.
Have
and
some
there's
sort of STD.
organic brain dysfunction because of STDs. Maybe that's really the problem.
Well, and I think, so ED, I mean, I think the older you get, the greater you have a chance of getting it, probably because of all the medical problems associated, more like the heart disease problems, the diabetes problems.
Some more
all those
reason
things.
to eat healthy, exercise, limit alcohol, all those things we enjoy doing or don't enjoy doing. April's like, I'm sold.
Yeah.
Eat healthy, because when I'm 90.
my aunt told me she did this stint on dating websites, and she told me, oh my God, enjoy sex now because when you get older, the men are just not as sexually active as you are. Like,
Oh, really?
Like, someone with a higher sex drive. Who
Oh,
would
well, that's
be her
unfortunate.
and I.
Yeah.
And she's like, oh yeah, they can't keep up. So
Oh, wow. Well,
it
and isn't it
freaks me
true
out
that
to
women,
get
well,
older.
Wow.
men peak younger, correct? This is completely
Boy, that's a good question.
additional.
I
Well, I've
haven't-
heard that before.
Yeah, I heard
men peak younger, and
peak
so
younger
women
and
are,
women are in their like 30s,
yeah.
mid 30s, 40s. As I heard.
I don't feel like I've slowed down any, so I'm really nervous now to get old. I don't
And I
want
don't think it's everybody. Maybe it's just people that she met, but she was very disappointed.
Well, maybe they have hip problems or back problems, or maybe they're just not as
We're just scratching the surface
cardiovascularly,
here. So many different
able to. But
rabbit
with
trails.
the ED meds out there now, it seems like any guy can most likely sustain an erection to have fun.
Oh
They
yeah,
want to.
and it wasn't that they had a problem getting erection. They're
just
I
not
guess-
as interested.
or just not as frequently as she maybe or.
I would like to see a picture of your aunt.
Yeah.
No,
And
Is it her or
retired
is it
people
like
are-
maybe it's like where maybe would be expected every night, where they're like maybe 2 or 3 times and they're good
Oh.
a week.
Huh.
I was like, oh.
So now I'm going to take it a step further because we haven't actually broached on the subject. So we talked about how erections happen. We haven't closed the topic out yet. Then what? I mean, we all know generally what happens, but why do erections go
They
away?
stop.
Or at what point do they stop?
Oh, so that would be that phosphodiesterase that breaks down that CMP, and then that smooth muscle relaxant isn't relaxing your smooth muscles anymore, so the pressure in your penis reduces, and then the veins can then allow the blood to flow out of the penis, and now your erection stops.
Oh,
And there it is. And now you're flaccid again.
Back to square one.
You know, and if you're a teenager, you're ready to go a lot quicker than if you're,
Oh gosh.
older.
That's a whole other topic there, right? What's the recoup time?
Yeah. That's a good question. I wonder if there is a study on that one. I haven't read one.
Yeah.
But how would you really even do that study? Take a bunch of 18-year-olds and, okay, you guys go in that room. And the 50-year-olds, you guys go in that room. You come out when you're done. All right, who's ready now?
Yeah, like timed event.
Yeah.
Does it be the CrossFitters or the marathoners?
Yeah. Seems dirty.
Seems wrong. It seems wrong.
But sometimes you just want that quick event.
True.
Yeah.
The quick in and out.
Scott's a marathon runner, so he's going to argue. He's like, he's not into CrossFit.
I need to be wined and dined, April. Don't just throw me on the bed. I need some romance.
You just have a busy schedule and you just gotta fit it in there.
That's awesome.
Let's get this done.
So,
But it's just interesting how you can bring up a really simple subject. Everyone thinks they know how erections work or they don't really care to know the details, but then you start talking about it and it's funny how it all leads way back to a person's overall health and, sleep and diet and, whether they're taking medications, long-term health issues, like you said, diabetes, all of that. It's kind of funny how, even kind of a simple subject leads way to back to the bigger picture.
it does, and I think there's not too many animal, I don't know why I'm getting off on this topic when you were talking about health. Have you guys seen The Monkey and the Frog?
Yes.
No.
You haven't
Is it
seen
like a YouTube video?
It's a YouTube video.
It's so
There
sad.
is a monkey doing some pretty seedy things to a frog.
Oh.
And
And so the frog is the recipient of the abusive
it
behavior.
is.
Yeah.
There was definitely
It's frog
some
rape.
forced fellatio happening.
Oh.
Yeah,
And
it's sad.
I don't know,
gosh.
at some point I'm sure that the frog was like,
Is this in the wild
this
or
is
is this
how
like
it
in
is.
a zoo?
This is in a zoo with poor kids filming it and
Oh,
everything,
yeah.
and that frog is really abusing, or the
Monkey
monkey is abusing the frog.
Yeah.
It's not okay.
Yeah.
And I don't know why I thought of that when you said everybody's health issues. This
Jumped
monkey and a
in.
frog
Yeah, you
jumped
April
into
out
my
just
head.
now.
I
Like you
know.
just went somewhere I can't even
Went
put
to
you
a
back
dirty
on that trail.
bestiality place.
YouTube, where we do that, right?
And thank God for YouTube, and thank God for you watching us on YouTube.
I'm not judging, I'm just saying.
I just think
What
it's
would we
nice
talk
we
about?
made it through this whole thing, and I think it's been rather PG.
For the most part,
Yeah.
you know, a few terminology here or there, but again, you know, even the non-PG, or it sounds non-PG, but again, we're just talking about the anatomy, we're talking about specific body parts, and there's really no way around that without, you know.
So, we've talked about penis size and finger ratios, and we now know that the longer your ring finger is compared to your pointer finger, the longer your penis will tend to be. And we've also talked about how erections work.
And lots of other
Lots of other
periphery
randomness.
conversation.
And that the average penis size is 5.17 inches, which is very exciting for those people who, when they measured themselves, were a teenager, all they've ever done was look at porn, and in porn, everybody apparently is like 10 to 12 inches long for some reason,
Right.
and you can't hold a candle. And so it was nice to see that average is, you know, a little more
Attainable.
attainable for the
average
rest of
man.
us. Yay. Thanks for tuning in, and if you would like to have your finger ratio enhanced, we'd like to thank Thomas Bailey from Deadbeat Special Effects, who might have potentially enhanced my ratio by maybe a millimeter,
Tiny little bit.
at most.
Just a little smidge. If you liked what you saw or heard today, please check us out on YouTube, on our podcast, or even our website.
Medicalconfessions.com.